Okay, let's start. Ma'am Angel, are you ready? Ma'am Angel? Okay. Please go ahead. The first question is, insertion of a needle by stretching the skin. Multiple choice po ito ha, can be applied to A, puncture with a long needle. So that means when you use a long needle, do you stretch the skin? Ginagawa ba natin yon? Letter B, when we puncture using a short needle, do we stretch the skin? And letter C, do we stretch the skin when we puncture those points where the skin is loose? Letter D, puncture the points where the skin is thin. What is the correct answer? Letter E, none of the above. Ma'am Angel?
So, ang answer po dyan, nag-insert po tayo sa letter C po, sa kung saan yung skin is loose po.
Okay, kaya ini-stretch mo. Loose kasi, di ba?
Opo.
Ang loose kasi may tendency hindi mag-aano yung needle. Very good. So let's continue with the next one. Okay lang po ba? Which
Opo.
of the following methods is suitable for puncturing with a short needle? So ano ba yung method na ginagamit natin pag yung ginagamit natin na needle is short? Letter A. Imagine nyo ha, I know this is but I'm sure some of you are already practicing, no? Inserting the needle aided, or let's say your insertion finger is the or the insertion hand is the right. Okay, aided by the pressure of the finger of the pressing hand. Okay. Letter B, inserting the needle with the help of the puncturing and pressing hands. So imagine nyo, dalawa ha, puncturing and pressing. Do you use that for a short needle? Short lang yan ha. Letter C, inserting the needle with the fingers, stretching the skin. Do you need to stretch the skin if the needle is short? Letter D, inserting the needle by pinching the skin. Letter E, none of the above. Ano pong sagot niyo, Ma'am Angel?
Ang sagot ko po, Doc, is letter A po, inserting the needle aided by the pressure of the finger of the pressing hand po.
Okay. Gusto niyo bang mag-share ng sarili niyong experience? Is this how you do it?
Po, yes po.
Yung pag-short, no? How
Apo.
short po is short?
Yung mga ano po, yung one con po.
Okay, very good. Let's go to number 3. Bladder 2 and intang, which is an extra point. Paano po natin pinapuncture? Letter A, with the finger stretching the skin. So when you stretch the skin, that means that area, the skin over that area is loose. Yung ba yun? Do you agree? Loose ba yung skin sa sa may intang saka sa bladder 2? Ini-stretch mo ba yung skin? Or letter B, the fingers pinching the skin, no? Letter C, with the help of the puncturing and pressing hands. Kailangan mo ba ang tulong ng puncturing and pressing hands? Letter D, do you use heavy pressure by fingers of the pressing hands? So ibig sabihin, just like intang, do you need to apply heavy pressure? Okay, letter E, none of the above. Ano po sagot niyo, Ma'am Angel?
Doc, ang answer po is letter B po, yung with the finger pinching the skin po.
Okay. Alin dito po ang nakasanayan nyo? Bladder 2 or intang?
Yung yintang po.
Okay. Talagang pinipinch natin. Maganda. Okay. Very good. Number 4, all the following points should be punctured horizontally. Nag-enjoy ba kayo so far sa questions? O wala pang mali si ano ha? Dapat bawal magkamali.
Opo.
After this, we will be deciding kailan yung ating during our practicum. Yung practicum natin, we will ask you to needle a point and you have to show us how you needle it. Would that be okay? Sa action,
Challenging.
para malaman natin na magagaling na tayo. Okay, let's go to number 4. Saan po ba dito ang hindi kasama sa grupo? Ibig sabihin, all the points are punctured horizontally except for 1 point. Is it stomach 8? Is it bladder 2? Is it REN 12? Is it bladder 14? Is it REN 7? Ma'am Angel,
Doc, ang answer po sa number 4 is letter C po.
paano nyo pinapuncture po yung letters, yung REN 12?
Ano po?
Basta pagpupagka naman.
Perpendicular.
Yeah, perpendicular, hindi or vertical, hindi horizontal.
Apo. Diretso lang po.
Diba? Nasaan po ba yung stomach 8, Ma'am Angel? Can you show us?
Maliligo lang ako. Stomach.
Stomach.
Stomach 8.
Two-third.
Nako ha. Parang sumay mo yan. Bladder 2, bladder 14. Asan yung bladder 14? Sa harap o sa likod? Bladder 14.
Sa likod po.
Sa likod po.
Sa likod. What about REN 17? How do you needle it? Do you needle it vertically?
Perpendicularly po.
Perpendicular? No.
14.
Nasaan ba ang REN 17?
Sa
You
dito.
needle REN 17 vertically or perpendicular?
Middle.
Vertically po.
Horizontally.
Ay, horizontal.
Kasi yung sagot mo dito, yung exception is REN 12.
Apo.
How do you measure REN 12? As a practitioner, you will encounter, I think most of my patients, kasi alam niyo mga Pilipino, mahilig kumain, no? Maraming issues.
Rechun.
Ang REN 12?
CB12 po.
REN 12 or CD12, how do you locate it?
Sa
From the navel.
Doc,
Forcon above the umbilicus, midline.
Yes po.
Or,
Trichun po.
Forcon above the umbilicus.
not 3, it should be 4.
Fortune.
Above the umbilicus. Okay, very good. Thank you po.
Fortune.
Number 5. Huwag masyado kayo ma-offend if yung answer nyo mali. This is the reason why we have assessment. I should know where your strengths are. I should know where you are very weak at. Okay. All the following points should be punctured obliquely, except. Ma'am Angel, do you want to answer?
Yes po, Doc. Letter D po. Ang answer po.
So, paano mo ini-needle si stomach 8?
Perpendicular po.
I'm sure. Are you sure?
Transport.
It's actually sub-Q, horizontally. Pag sinabi mo kasing obliquely, hindi siya talaga nakahiga. No? Lung 7, I think it's understood. Diba? Oh. Okay. Do 23, alam nyo na po nasaan. Diba? Okay, let's go to number 6. According to Chinese acupuncture and moxibustion, the bakshu point located below the spinous process should be punctured. Paano ba natin pinapuncture ang bakshu?
Obliquely, Doc.
Obliquely. Is it towards the midline or away from the midline?
Away from the midline.
Away from the midline.
Towards. the midline.
Toward.
Bakit
Towards
iba
the
yung
midline.
sagot nyo?
All bakshu except
Bakshu po yun
now.
towards the midline.
Okay, towards the midline. Walang personalan ha. Okay. Yun po tama, hindi po away. Actually, wag ka mag-away kasi matatamaan mo yung mga organ. And the reason why you need to do it obliquely because hindi siya po pwede except for bladder 23. You can
Yes.
do it perpendicularly. Nag-iiba na kasi yung location niya pagdating sa 23. We will also deal with this in detail when the right time comes. I hope this is not going to bore you. Sa totoo lang, this is going to be the meat of your practice. No? Kasi kung mayroon kang ma-encounter na practitioner or may gustong matuto and then nasa medical field, 'di ba? So and by the way, baka next week we're going to do a little anatomy. Would that be okay? And
Yes, doctor.
Yes, Doc.
and I think you have all the
Yes, doctor.
there are only 5. I think kayang-kaya nyo yun for 2 sessions. Para hindi boring kasi I'm thinking of giving you all the next week kasi I would encourage all of you to join us during the ano bang topic? Yuan source. We'll start with the anyway, sige, papadala ko na lang. Mag-attend po kayo sa Monday 8 to 9. The topic is Yuan source points. Okay? And also on Tuesday and Wednesday, the topic is Shi cleft point. And you won't regret it. No? I believe that the best way to study the points is by categories. I don't think you would want to study all the points. So we will categorize them. For every channel, meron tayong mga categories. Okay. Number 7. Who would like to answer this? Can we hear from... ubusin na natin yung 10, Ma'am Angel. Ha?
Yes, Doc.
Okay, which of the following methods would you utilize to stimulate the points? Nasaan po yung mga points na yan? Where
Doc, letter D po, nandito po sa mga daliri natin or sa yung mga
nasa
malapit
dulo.
po sa nail. Opo, pricking to cause
So usually pag sa dulo, you have to cause bleeding. You prick.
Opo.
What type of needle are you going to use? Pwede
Lancet po.
the 3-edged needle or
Opo.
yung lancet. Okay.
Opo.
Number 8. Which of the following methods would you use to stimulate REN8? Asan po ba ang REN8, Ma'am Angel?
Pushod.
Where is the REN8?
Sa,
Baba ng puso.
nasa baba ng puso, Doc. Nasa dibdib.
Ayun hindi kayo nag-aaral.
Pushod.
Nasa pusod.
Pushod.
So do you needle the pusod?
No.
No, doctor.
No.
No. So what do you do?
Moxibus.
Sebastian, doctor.
Okay. Anong klaseng moxibustion? Are you going to directly heat it or are you going to put something we do it indirect. Actually, pwede ka kumuha slice ka ng maninipis na ginger slices and you put a holes pala, and then you put the moxa wool. Okay, moxibustion. Actually, yung ating is REN8. That is our baseline. So if you go down, okay, anong point po yung 1.5 soon below the navel, below REN8? Ren yan lahat yan, di ba? Anong point po yon?
Ren 4.
Ren 6.
Ren
6.
6.
Ren 6.
Nako, wag niyong kalimutan yan. I always do that as
See
in.
your brand.
Why do you need to needle Ren 6, Dr. Ryan?
To tonify.
The what?
Tonify, what do you call this?
Ayan, the
Silbren.
Okay. What about Ren 4? What is it for? And by the way, how do you locate Ren 4?
1.5
No.
kun below. Ren 4 is between Ren 2 and 6. So, mga yan. One kun?
3 tune.
No.
3 tune.
3 tune from
Three.
below the navel is
3
Ren
tune.
4. 1.5
tune.
tune below the navel is Ren 6. Practice na po kayo niyan. Okay?
Ren 6.
Sino yung maingay? And then, what about, meron po akong technique, yung above the navel. Okay, how do you locate, Sir AK, Ren 12 again? Using the navel as the baseline?
Fortune, Doc.
Okay. 12
Above.
minus 8. Ren 12 minus 8. So fortune pataas.
Yeah.
What about Ren 9? Ilang tune from the navel? Above the navel. 9
One.
minus 8.
Ay. One.
1. Okay.
One tune.
Yun na.
Above the navel.
Above the navel. Eh kung Ren
One
15, ilang tune siya from the navel? So subtract. Minus 15, ilan? Ilan?
Four. Wait lang po.
Okay, another very important question. Whose tune are you going to use? Your tune or the patient's tune?
Patient.
Patient.
Patient tune.
Don't
Patient.
forget that.
Patient tune.
Huwag mong hilahin yung kamay niya, nagiging uncomfortable. I-estimate, compare mo yung...
Estimate based on your hand.
Yes. Okay, practice, practice, practice. Kung ako po sa inyo, magsimula kayo sa inyong mga kamag-anak. No?
Correct.
Yeah, if you really care for your family, nako, you have to do needling already. Okay? And by the way, the points that we are teaching you are all safe as long as you do them properly. So, ibig sabihin with acupuncture, technique is very, very important. Okay? Number 9. According to Chinese acupuncture and moxibustion, all the following are reinforcing methods except. What's your answer, Ma'am Angel?
Letter B po, Doc. Yung inserting the needle rapidly.
Okay, can you tell us, how do you do reinforcing or tonifying?
Ano po, Doc? Dahan-dahan lang po. Tapos niro-rotate mo ng slowly po.
Dahan-dahan.
Apo. I-rotate mo ng slowly po.
Okay. Do you keep the hole open?
Hindi po, Doc.
Anong technique na yon pag ino-open mo yung hole? Nilalakihan mo yung hole? Sedation or
Sedating.
reduction.
Sedation.
Okay? So dito, ang mali lang po dito is letter B. So ibig sabihin, you lift the needle gently and slowly. Slowly. Parang pinaparamdam mo sa kanya. No? So slowly ang technique. And then, you keep the needle, the hole closed. Kaya you always use the cotton, like paliit. Isasara mo. Rotate the needle gently and slowly. Tapos maliliit lang yung amplitude. Okay? Then rotate the needle forward with the thumb. Okay. Not everybody does this. Yung technique ng iba, katulad ko, I just do like pag nagtotonify ka, nag-reinforce ka, you insert the needle slightly obliquely sa direction po ng flow ng normal flow ng qi. Okay. Let's say, Ma'am Angel, gusto mong i-tonify ang lung. How would you insert the lung 7? Papunta sa elbow or papunta sa thumb?
Papunta po sa tongue.
Okay, very good. Okay. Alam na po natin yan, ha? Okay, number 10. O, punta naman tayo sa reducing methods. You know, I like questions like this kasi aaralin mo yung 4. Okay, sagutin mo na rin, Ma'am Angel.
Opo, Doc.
What's your answer here?
Sa number 10 po, all the following are reducing method except yung letter C po, yung setting the mountain on fire.
Okay, what technique is setting the mountain on fire? Lalagyan mo ng apoy. Ano ba yan? Reducing or... Pag mag-aano ka, lalagyan mo ng apoy yung mountain. Ano bang ginagawa mo sa pasyente?
Matotonify po.
Tonify.
Okay, initin mo. Okay, see? Pointing the tip of the needle against the channel course. Okay, you want to reduce the heat, Ma'am Angel. How will you needle LI11?
Sedate.
Where do you point the tip of the needle? Going down or going up?
Going down po.
Very good. Lift the needle forcefully and rapidly. Mabilisan. Lift, ha? Okay. Trusting the needle gently. Yung pagpasok, dahan-dahan. Pero malali. Then, pagtanggal mo, mabilis and forcefully. And then, lalakihan mo yung butas. Keeping the hole open. Okay? Number 11. Okay, tapos na tayo ka, Ma'am Angel. Let's go now to Ma'am Teresita Sumile. Another valedictorian, o di ba? Ma'am Teresita,
Yes po, Doc. Good
would you like
evening.
to read your answer, please?
Okay po.
The question, sorry.
All the following points are often stimulated by pricking to cause bleeding, except A, ear apex, B, bladder 40, C, extra, D, LI4, and E, extra. My answer po, Doc, is letter D.
Okay.
LI4.
You don't prick to cause bleeding ang LI4. Okay.
Po.
Ear apex, what conditions do you usually prick to cause bleeding yung apex?
High blood pressure.
Yeah, high blood pressure, allergies, yung mga ganon. Very good. Bladder 40, where is it commonly used? Mga itching, mga low back pain.
B40, low back pain, lumbago, doctor.
Ang galing. I'm so proud of you. What about this point? Extra point, 6-1. Where do you look? Where do you find it? Okay. This is very useful pag yung pasyente mo, they're all located sa tips ng 10 fingers. Point 1 soon, distal to the nails, no? It's so useful for reviving a patient pag nawala. I don't know if I pronounce it right. I don't want to pronounce it. Hindi ko pa ni-research. But you have to needle all the 10. Point 1 soon, distal to the nails. Yintang. Okay, alam nyo ba, pag binleed nyo yung yintang, napaka-relaxing po for the patient. Okay? Congratulate yourself, lalo na ngayong panahon, ang init-init, pag tinanggal nyo yung needle, nag-bleed, ay that's a very good thing. Okay? Congratulate yourself. And also, pag nag-bleed po yung sa ear, just let it bleed. Standby ka lang sa ano, you just have to, kasi it's so beneficial, no? Very relaxing.
Yes.
Any question before we proceed? Okay, wala na. Number 12. Ma'am Teresita.
Which of the following methods is appropriate for the point stomach 17? A, puncturing perpendicularly. B, puncturing subcutaneously. C, pricking to cause bleeding. D, moxibustion. And E, none of the above. My answer po, Doc, is
Where is
letter
stomach
E.
17?
Ma'am, Doc?
Nasaan
My
ang
answer
stomach
po.
17?
My answer po, Doc, is letter E. None of the above. Hello po. Because acupuncture and moxibustion at this point are contraindicated po, Doc. This point serves only as a landmark for locating points in the chest and abdomen.
Okay. Yan po yung stomach 17.
Stomach 7. Stomach 7.
Ingay.
Maple.
Ano yun? Okay. Number 13. Ma'am Teresita, do you want to answer?
Yes po. Which of the following methods is appropriate for the point stomach 18? A, puncturing obliquely, 0.3 to 0.5 inch. Puncturing, letter B, puncturing perpendicularly 0.5 to 1 inch. C, pricking to cause bleeding. D, all of the above. E, none of the above. My answer po is letter A, Doc. Puncturing obliquely, 0.3 to 0.5 inch.
Where is it located po?
Stomach 18. Sandali po.
Nako, dapat alam nyo yan ha. Anyone? Where is stomach
Below-
18?
Below the nipple.
Okay,
Doc.
directly below the nipple. So you just have to needle very, very obliquely. Very good. Okay, number 14, Ma'am Teresita, hanggang 15 po kayo. Number 14, according to Chinese acupuncture, asan ba yung gallbladder 21?
Nasa may bandang shoulder, Doc.
How do
Dito
you
sa may
locate it?
tracks.
Okay, this is what you do. Yung right arm nyo, ilagay nyo sa left balikat nyo. Then yung left arm nyo, lagay nyo din doon. Tapos hawakan nyo. Yun na po ang GB21. Okay?
Yes, doctor. Thank you.
Okay, what do you use it for? Where is it used for?
Usually, doctor, included siya sa shoulder pain at saka sa neck. Ini-include din namin siya, doctor.
Actually, it's very good for
Upper limb.
women who deliver. No? Para hindi
Lactating.
masyadong masakit. Lalo na pag
Oh.
primary, first time. Oo. Okay, so you needle it, how? 0.3 to 0.5 inch lang perpendicularly. Have you heard of the needle LEPs? ELIPEAS? Ay nako, you should order that. It's so good. Diba, Dr. Ryan?
Yes.
It comes in 5 sizes. I won't tell you where to buy it. You know how to order it. Wala naman akong porsyento doon. But anyway, may mga ganito 0.3 to 0.5 soon. So you definitely wouldn't like to use a long needle here. So it's, can you imagine yung comfort na maibibigay nyo sa pasyente, lalo na pag nagde-deliver. Okay? Locate nyo po. Yung right arm, right finger nyo, right arm, ilagay nyo po sa shoulder nyo sa left. So with the left arm. Okay, number 15. According, again, to the Chinese acupuncture and moxibustion, U15 should be punctured. What's your answer, Ma'am Teresita? Ma'am Teresita.
I'm sorry po. My answer po, Doc, is letter B. 0.5 to 0.8 inch perpendicularly.
Okay, where is it located po? Naku, paano yan? Huwag tayo puro lang libro. Where is it located? Of course, nasa midline siya.
0.5 con above the posterior hairline.
Yeah, where is your posterior hairline?
It's on the back.
Okay,
of your
mamaya
head.
pag-usapan natin yan. Papasubo kayo ha, yung mga soon measurement. You should memorize that. To be honest, I haven't memorized all of them, but somehow may idea no po ako. And let's start memorizing. Okay, 0.5 to 0.8 or inch perpendicularly. Okay, why? What is the risk there?
Puncturing the medulla oblongata.
Oblongata. Okay, very good. Next, let's go call. Punta naman tayo kay. Okay. Let's call on Sir AK. Are you ready, Sir AK?
Yes, Doc.
Okay, let's go to number 16. You will handle 16 to 20. Grain
16
like,
to...
yeah, 16 to 20.
Yes. Okay, Doc.
Intradermal needle. Saan mo dapat hindi siya ibaon?
Stomach 17, Doc.
Why?
Delikado, Doc.
Yeah, you never needle that. Needle din yan eh. Oo. Pero yung iba nagpapa-piercing dyan, di ba? Ano kayo masasabi?
Masakit. Ano yan, Doc, eh. Tawag dito, mahapdi.
Ano, try mo na? Mag-piercing? Okay, sige.
Mahapdi yan, Doc. Pisilin nga, Doc, mahapdi eh.
Mamamaga, oo. Anyway.
Opo,
Number
Doc. Medyo
17.
sensitive yan, Doc.
Oh, ito naman auriculotherapy. In treating disorders on the trunk. Alam nyo, ang daming may problema sa trunk. Okay?
Yes.
If I were you, you try to master it. I hope you have a copy of the book on ear seed acupressure. I think you have that. Okay. Sir,
Anti-helix, Doc. Anti-helix.
okay. Basta,
I remember, Doc, nung minsang nag-auricular tayo sa clinic, isa yan dun sa mga pinalpate mo na sabi mo meron siyang pamamaga.
okay.
Naalala
Very
ko.
good.
Dun sa picture pinakita mo, then may difference yung left and right ko
Right.
na ear.
Yeah, very good.
Alala.
At saka itong yeah, great, excellent. Pag may nakita kayo, alam niyo naman siguro nasaan ang Simba Concha, Cavum Concha, no? Pag maitim yung area na yon, doon ka magfo-focus kasi may problema. And pag lalaki, makikita mo yung problema pag using the left ear. Pag babae, right. Okay, maraming salamat. For the lobule, try not to needle the lobule, but instead you use ear seed or ear pellets. Kasi madali pong mahulog yung needle dyan, no? Okay, very good. Next, we go to number 18, Sir AK. Ano yung hindi tamang point for treating diarrhea? Inappropriate.
Sympathetic point, Doc.
Okay, bakit po?
Siya yung walang masyadong connection dun sa diarrhea. Because lahat po ito meron, Doc, eh. Large intestine, small intestine, spleen, heart point.
Heart point.
Lahat ito lahat siya may mga points na nagsasabi na nakakatulong para doon sa diarrhea. Depende doon sa situation ng patient.
Okay, very good. Let's go to number 19. Saan po tayo hindi gagamit ng 3-edged needle?
Palpation ng insomnia, Doc. Letter E.
Palpitation.
Kasi lahat ito is palpitation ng insomnia. Lahat kasi ito, Doc, almost kumbaga parang emergency yung situation nila. So kailangan siyang tusukin at paduguin yung kalakan dito. Na mabilis na makakatulong para lumabas yung init.
Okay, very good. Kasi yung mga yin deficiency, katulad usually nagkakos ng palpitation and insomnia. Hindi siya masyadong kasi you do bleeding kasi pag sinabi mong 3-edged needle, di ba? Okay, very good.
Yes, Doc.
Let's go to number 20. What is the function of moxibustion?
To warm the channels and expel cold, to induce the smooth flow of qi and blood, to strengthen yang from collapse, to prevent diseases and maintain health. All of the above, Doc.
Okay.
Lahat po ito.
Okay, maraming salamat po, Sir AJ. AK pala, AJ.
Thank you din po, Doc.
Thank you rin. Okay. Okay. Let's go now to 21 to 25. Sir June Azariel. Alam ko, alam mo ito lahat. Let's go to 21.
Which of the following methods would you use first to treat a patient with excessive sweating, cold limbs, and undetectable pulse?
Ano po ba ang risk? Yeah, okay, what's the answer?
Letter C po, moxibustion with salt po.
Bakit po?
Oxybranch. Kasi po,
Sir, bakit hindi
ay,
garlic?
kasi po, ang para sa inyo po kasi is ang pag-sweating excessive na po. Ang ginger po at garlic is common po kahit sa tertiary measuring. Ano yun? Common po na ginagamit. Pero po yung salt po, parang hindi po yata. Wala pa po yata kung anong ganun.
Yeah, it's because para hindi mag-cause ng electrolyte imbalance, no? Remember, nag-excessive sweating, tapos cold limbs pa, no? Cold limbs, that's already telling you meron ng tibiyang most likely. Saka undetectable pulse. Okay? So, kailangan mong ayusin yung electrolytes niya. Okay, very good. Number 22, Sir June.
All of the following diseases may be treated by cupping except cupping. Letter ano po? Letter E.
Okay, do you do cupping on spontaneous bleeding?
Never.
Opo. Never po kasi po, ano na nga po nag-bleeding na nga siya, ikakaping mo pa.
Okay, sige. Number 23. Which, ito, memorize nyo yung channel ha. Napaka-graphic na nga yung channel pathway. Diba?
Which of the following channel does not run securely towards the head and face? Head and face. Head and face. Channel.
Pakita ko sa mga channels. Alin channel ang hindi umabot sa face?
Letter D po.
Ano yon?
Yingwell channel.
Yinwei Mai. Di ba ito hindi umabot. Okay?
Opo.
Memorize nyo yung mga channel ha.
Opo, Doc.
Baka mga YouTube channel lang yung
Subscribe.
Okay, punta naman tayo sa tune measurement. Ito madugo ito. As in,
Po, 1 tune, 1.5 tune, 3 tune,
1.5
tune,
tune,
1.5 tune, 3
10.
tune.
Okay, ito yung 2 tune and then ito yung 1 tune.
Opo, 1 tune.
Okay. Pwedeng yan ang i-measure mo, pero pag mahaba siguro mukhang nakakaduda, no? Okay.
Kamay po, ang kami ko po kasi igurot kaya maliit yung kamay.
Okay. Sige. Memorize na po. The distance between the mastoid processes. Nasaan ba ang mastoid process?
The back of the ear.
Oo nga, sa likod. Back of the ear.
Ulo.
Ilang tune yon yung distance ng dalawa?
9 tune po.
Let's take a look. Gets nyo na?
Opo.
Kita nyo?
From the, opo.
Okay.
4.
Tingnan nyo from the posterior. By the way, sige, papunta tayo dyan. Posterior hairline. Paano mo ilolocate yung posterior hairline mo? Ano ba yung distance from the anterior to the posterior hairline?
Yung anterior po ay...
yung mismong ano po, Doc.
From the anterior hairline to the posterior hairline. Ilang tune?
Opo.
12 tune.
By the way, how do you locate your anterior hairline?
Dito po
Sa forehead.
Dito po sa forehead. Pag nalalagas
Three
na po.
tune from the
From what?
eyebrow.
From yintang.
Yintang.
From
From the
glabella.
yintang.
Oo, 3 tune.
Opo.
Sige, measure nyo yung 3 tune nyo. Baka umusad na. So dyan, yung anterior hairline nasa gitna na. Okay, from the anterior hairline, measure nyo na hanggang sa posterior, that's 12 soon. Okay. Anyway, let's go to the distance between the two nipples. Yan, importante po yan. Sir, what's your answer?
8 tune.
Okay. So, ibig sabihin, fortune from the midline. Sige, measure nyo kung ganun pa yung nipples nyo. Yung iba nakapunta na sa...
Tune.
Sige na, walang nakakapagkita.
Fortune, Doc.
Ay, fortune?
Yes.
Fortune lang.
Bali, 8 June po. 4 plus 4, 8 June.
Fortune. Okay. 5,
Yes, Doc.
8 soon. Very good. Yan po, kita nyo na, 8 soon. Measure nyo
Sa
kung
akin
talagang
parang
8 soon.
10.
Ang layo naman sa iyo, Remo. Ay,
Okay.
sarap.
Memorize nyo yan. Okay. Ano yung point sa gitna ng nipple?
Stomach 17.
Ano
Ano,
sa gitna ng nipple?
CB14. Ay, 17.
Ren.
Ren
Okay.
17.
Yes, Ren 17.
Kung ang babae, malaki yung ano, 'di ba? Minsan yung nipple nakaturo na sa baba. Ano yung basehan mo? Sige, we'll go there.
Yun lang, doktor.
Kung lalaki, walang problema.
First.
Ano? Anong ba siya?
Doc,
Okay.
di ko pa na-try yan, Doc.
Sige, try mo na ngayon. Okay. Maraming salamat, Sir June. Punta naman tayo ngayon kay Ma'am SP.
Ay, good evening, Doc.
Good evening. Sagutin mo 26 to 30. Okay.
Oh my God, Doc. Sige po.
Ito, kanina lang natin to minention. Distance from the anterior hairline. I'm sure i-check ni Sir Leo yan ngayon.
Yes,
Kasi
the distance from the distance from the anterior hairline to the posterior hairline is 12 June, Doc.
Okay. Ano yung distance? How do you locate your anterior hairline?
The anterior at the back po, Doc.
No. Paano mo ilo-locate yung anterior hairline mo?
3 cones above the yin tang.
3 June to the no?
Okay. 3 soon from the yin tang. Very good.
Yes.
Now, how do you locate do 20 without using the tip of the apices of the auricle?
From
Posterior
the
hairline.
posterior area.
Ilang
to the-
tune?
Yes. 3 June, then 5. Bali, 8 June,
Wait
Doc.
lang po, may online mo eh.
Ganun.
Online lang si Mama.
4
Nako.
Bali,
Google.
3 June, Doc,
Where is
from the
220?
posterior. Then 5, bali, ito.
Ilang tune ba? Ilang tune ba ang ano? Actually, 7 and 5. Di ba? 7 and 5. So,
Yes.
7 tune from the No, 5 tune. 5
5 June, Doc, yes.
5 tune from anterior
5
hairline.
tunes from the where okay, yan na from the anterior hairline. So 7 tune posterior hairline. So posterior hairline to do 20 is 7 soon. Okay.
Yes.
Number 20. Ito na po memorize na yan ha. Pati yan, yung
Yes.
iba ang layo na nung ano.
Parang isa na po ako doon.
Okay. Number 27.
Receiving hairline, Doc.
Number 27, the distance from the sternocostal angle. Okay, sternum. Dapat alam mo na saan yung sternum. Magkakaroon tayo ng konting lecture niya next week.
Ito po.
You study on your own.
Costal, yung ribs.
Ribs. To the center of the umbilicus is, this is important. Ma'am SP, what's your answer?
27.
Teka, Doc.
Okay.
From the sternocostal angle to the center of the umbilicus is how many tune?
8.
Okay, let's take a look. Ito na po, sternocostal to the umbilicus. That's 8 tune.
8 June.
Ano yung nasa gitna niyan?
Na, sa gitna
point.
po,
Xiphoid process.
No.
hindi, Doc, Ren 12, Doc, from the
Ren
navel.
12. Are you sure?
Yes, Doc. Ren 12.
Okay, you should be sure. Okay. Fortune. Okay, very good. Ma'am SP, kayo pa rin. Distance between the medial border of the scapula and the posterior midline. Nako, napaka-importante po nito. May technique si Dr. Ryan paano i-locate yung scapula, yung shoulder, pa? Ang tawag doon. Inferior angle.
Yeah.
What will you ask the patient to do?
Put your arm behind your back.
Okay, then makikita mo yung
Makikita mo yung
outline.
ridge ng ano mo, scapular ridge, and then that's where you locate the medial sternal border.
Okay, you do that. Thank you very much, Dr. Ryan. So 28, the answer, Ma'am SP, is
Symphysis.
anong importance po nito? Like, why do we need to know the measurement between the medial border of the scapula and the posterior midline? Ma'am
Back shoe.
SP.
Oh, sorry.
Back shoe and the outer back shoe.
Yes.
Actually, yung back shoe is sa gitna nung dalawa. Di ba 3 soon?
Yes,
And back shoe 1.5 soon.
1.5.
Yeah,
1.5.
okay. So, hanapin mo yung gitna nun. So, ilocate mo muna yung medial border and the posterior midline. Sa gitna nun is the back shoe. Very good.
Yes.
So, all of you have the probe. Meron na po kayong probe? For
Yes
both?
po, I have my own.
Yeah, okay. Wow. Ito na po ang picture. So 6 tune, 3 tune. So from the posterior hairline to locate the inferior border of C7, how many tune?
3.
Okay. Sino yung sumagot ng 3? Bakit natin kailangan malaman yan?
Doctor, kasi yung landmark po kasi ng C7, ginagamit din yan para malocate yung mga back shoe points. Tapos yun din po yung, yun din po yung gagamitin natin. As a
Anong
landmark.
point po yung between C7 and T1?
Do 30, if I'm not mistaken. Basta back shoes for the lung.
You are mistaken.
Mali, doctor?
You are mistaken. It's not do 13. Okay, you Google do 14. Where is do 14? Where is do 14? Okay, below the spinous process of the 7th cervical. So that's the importance. So para ma-locate mo yung do 14 accurately, you need to locate the posterior hairline and the inferior border of C7.
Yes, doctor.
Okay. Where do we use do 14? Pag mainit, di ba? Kung kulang sa init, you tonify. Like for example, gusto mong bumaba yung zipper. Paano ang direction ng ano mo, ng needling mo? Going up, pointing up, or pointing downward? Sir Leo. I'm talking about do 14. Paano ba ang flow ng do meridian? Going. So if you
doctor,
want.
ang ano po niya ay pataas. Yun po yung usual na flow.
Okay, so kung gusto mong ibaba
So kung gusto mo pong ibaba, the direction should be opposite the flow.
Okay, very good. Ngayon, kung nanlalamig yung pasyente, ang lamig-lamig ng kamay.
Follow with the flow nung do channel, doc.
Wow, ang gagaling. Okay. Thank you. 29, kayo pa rin, Ma'am SP.
Ako pa rin ba daw?
The distance between the end, ito napaka-importante po nito as in, especially when you locate the long points. No? Distance between the end of the axillary fold and the transverse cubital crease is, what's your answer? Yan o. Between that, can you see it? Axillary fold and the transverse crease of the transverse cubital crease of the elbow. Ilang tsun po yan? Anong sagot po? Sagot? Ma'am SB,
Yes, Doc.
hindi mo ba
Ayun.
nakita to? Oh.
Sa ano to?
Ilang tune? Ako ha, basahin nyo yan.
Doc, anong 9th June?
Okay, very good. Letter D. And last number 30. Ano po yung distance between the cubital crease and the transverse wrist crease? Di ba pinakita na kanina pa?
Yes, pinakita na, Doctor.
Ano answer?
12 June, Doc.
Okay, very good. 12 tune. So 9, 12. Remember that. Napaka-importante po niyan. Next. Maraming salamat, Ma'am SP. Sinong gusto
Thank you, Doc.
here next? Can we call on Sir Leo?
Yes, Doctor.
Guys na yata ito. Okay, go. Distance between the...
The distance between the superior border of the symphysis pubis and the medial epicondyle of the femur is A12, B10, C13, D16, and E18. Number 31.
What's your answer?
Letter E, 18.
Okay, do you see this one? Can you see
Doctor,
that?
letter E po.
Okay. Tingnan nyo ha. Can you follow me? Can you see the picture?
Yes, Doc.
Oh, di ba from the... Ano to?
18 po, Doctor.
Sternocostal up to the navel is 8 tune. Then from the navel to the symphysis, upper border of the symphysis pubis is 5 tune. Okay? So i-estimate mo lang. So i-collocate mo yung, what do you call that anatomical, medial epicondyle of the femur. Dito. Medial epicondyle. So from the medial epicondyle and the upper border of the symphysis, so makikita mo na yung pubic hair niya dyan. That's already 8. Okay? Okay. What point is located 5 tune below the navel? Research. Sige, mamaya na. Punta na tayo sa next. 32.
Papa.
32.
The distance between the inferior border of the medial condyle of tibia and the tip of the medial malleolus is 32.
Ilang tune?
13, Doctor.
Okay.
13 tune.
So, from the heel, so, bakit itong isa 16? Kasi abot na sa heel yan. So, ibig sabihin, from the medial malleolus to the heel is 3 tune. Remember that.
Opo.
Okay. 13 tune, 18. 18, 13.
18 and 13.
Okay. 10 plus 3. Next, number 33. The distance between the prominence of the trochanter and the middle of the patella is...
Nakita ko po yan, Doctor. C, 19.
Check lang.
C, 19 po, Doctor. Yan po yung kanina. Ayan po.
Okay.
Kabilang side.
Sa ano siya? Sa patella, ha?
Apo.
Patella. 19.
Apo.
Eh, yung 18, ano yung ano doon?
Yung kanina po, Doctor, yung
femur.
trochanter, if I'm not mistaken.
Yeah, greater trochanter of the femur. Okay. You just add 1 tune. Next, number 34. Very good. The distance between the center of the patella and the tip of the lateral malleolus is...
Yan na po yung kanina, Doctor, yung 16.
Okay,
yung
very
nag-usapan
good.
natin. Apo, letter A, 16.
Okay. And ito na. And number 35. From the tip of the lateral malleolus and the heel is?
Between the tip of the lateral malleolus and heel. Yun po yung kanina, yung sinabi nyo, it's 3 tune.
Okay, very good.
Difference.
Very good. Congratulations.
Letter C, doctor.
Perfect. Okay, go. Okay, tawag naman tayo ng iba. Mukhang inaantok na yata yung iba. Okay, let's call on Ma'am Darlene Federico from Okada. Ma'am Darlene. Okay.
Yes, Doc.
Okay,
Hindi ko sure dito, Doc.
Ay, hindi ka sure. Dapat sure.
Try natin,
Not to
Doc.
be sure. Okay. Distance between the center of the umbilicus and the superior border of the symphysis pubis. Sinabi na natin kanina yan. How many tune? Kita nyo yan?
Opo, 5.
Ilang tune? So your answer
5 tune.
Okay, 5 tune. Number 37. Boring, no? Sige, tiis-tiis lang. Distance between the end of the axillary fold on the lateral side of the chest and the tip of the 11th rib is
11.
Kita natin. Ilang tune yan? Ano nababasa nyo?
Nakalagay po. 12.
12?
Axial fold and 12. Oh, 12 nga. Baba na 9.
Okay. From the axillary fold, end of the axillary fold, lateral side, and the tip of the 11th rib. Okay. Next, number 38. Ano ang distance between yin tang and do 20? O, di ba sinabi na natin yan kanina?
Fortune. Ay.
Ay?
Hindi. Distance between. Sorry.
8.
3 plus 5.
Do
8, 3 and 5.
3 plus 5.
3 and 5. 8.
Ang galing. Okay. 8. Okay, very good. So yon. Do you have the probe, Ma'am Darlene?
I'm getting one, Doc. Wala pa po akong probe.
Very, very helpful. That's the probe for the ear and also the body points.
Okay. Yes, Doc.
Okay. Thank you. This time we have
po.
another time. Okay. You answer A if 1, 2, and 3 are correct. Sasagot nyo ng B kung 1 and 3. You answer C pag 2 and 4. You answer D pag 4 is correct. And if all are correct, letter E. Memorize na?
Letter D pa.
Ngayon, kakaalaman na sino nag-guess. You answer A, this is called the Morse type. This is usually the exam they give in medicine. 1, 2, and 3. Pag yung 1, 2, and 3 are correct, the answer is A. Okay? Pag 1 and 3 lang, the answer is B. Pag 2 and 4, you answer C. Pag 4 lang ang correct, you answer D. If all are correct, 1, 2, 3, and 4, you answer
The answer is E.
Now let's start with the first one. There are 31 questions. I hope we can finish by 10. Can you call on... Ito ba hindi natatawagan? Dr.
Ako,
Sue,
Doc.
are you ready?
Ako, Doc, di niyo pa ako natatawag.
Ay, sino po?
Si Omer po.
Ay, Sir Omer. Yung nga
Hindi
pala,
ba?
how can I forget Sir Omer? Oh, first 5 questions, Sir Omer.
Part 2, sir. Number 1. In clinic.
Sige.
In
Basahin nyo
clinic,
naman,
the-
sir.
Ayan, sir. Babasahin ko nga, sir. Ito. In clinic, the depth of insertion of a needle depends upon number 1, the constitution of the patient. Number 2, the location of the point. Number 3, the pathological condition. And number 4, the length of the needle.
So what's your answer?
I think, sir, number 1, the constitution of the patient, and the other one is the location of the point, and number 3, the pathological condition. That's letter A.
Okay. What about the length? Hindi mo isasama? Siyempre pag okay, wala siyang kinalaman, di ba? So wag mo na ibabaon lahat, di ba? Okay, okay, talking about the constitution of the patient. Pag yung patient mo medyo mahina, medyo masakitin, are you going to needle very deeply?
No, sir. No, of course not.
Okay.
A little bit only.
What about for those patients who are seriously ill?
Yes, it depends on the condition of the patient, pathological condition. You're going to insert the needle deeply.
If excess or deficiency?
If it is deficient, sir.
Okay, because you want to tonify. Okay, very
Yes,
good.
sir. Okay, thank you, sir.
1 to 5, sir, ha? Galing-galing. Wala. Okay. Which of the following points are often needed obliquely? I'm sure alam nyo po ito.
Which of the following points are often needed obliquely? Number 1, like.
Hindi. Liache.
Liche, sir. Sorry.
Ganito,
Number 2,
sir. Liache.
Liche.
Ganito, liache. Liache. Oh, memorize ni Sir Leo yan. Liache.
Liache.
Wala, wag ka naman.
Salamat
Wag ka
po kay
nakakahiya.
Ma'am Julie.
Oy, pinapanood na
Liache.
tayo ng ano ha, ng Taiwan.
Liache.
Huwag na tayong mag-trying hard. Okay, saan po dito ang nininidal natin obliquely?
Which of the following? Sir, I think all of them are correct.
Okay, very good.
Yes,
All
yes,
are
yes,
needled obliquely. Lung 7, LI6. Where is liver 14? Yan na. Kaninong front mo ang liver 14? Kayo talaga, minemorize mo lang yung mga...
Liver 14, sir. Wait,
Ano yung ano ng liver 14?
It's near the nipple, right nipple of the male.
Okay. Kaninong front mo si liver 14?
Ulit, doctor.
Liver 14 is the front move of what organ? Of what channel? Example, meron kang pasyente na galit na galit or kasi uminom. So, ibig sabihin acute. Liver 14 is the front move point of the liver channel.
Liver channel or liver organ.
Okay,
Yes.
Sir Omer, when do you use liver 2? Do you use liver 2 pag yung pasyente galit lang? Saka, do you use it even when the eyes are not red?
Yes, yun. Kasama yun.
Eh kung nagalit lang, hindi pa pulang-pula yung mukha, anong gagamitin mo? Will you still use liver 2? Kilalanin
Liver-
natin yung mga points.
Galit. Temporal.
Ano mas mababa? Si liver 2 or liver 3? You,
Mas mababa po si liver 2.
Deliver 2, mas mababa.
So are you
Pag
familiar with the
mataas,
5 shoe points?
yes. A bit.
Liver 2, liver 2.
Okay. Anong category? Anong ano niya? Anong klaseng 5 shoe siya? Is it Jing Luo? Is it Yin
Spring.
Spring?
Ano?
Spring.
Is
Spring
it,
dapat.
Ano, shoestring, Doc?
huh?
Ay,
Yes, spring.
Okay, mag-attend kayo next time. Okay. Kailangan yung basahin yan mabuti. Okay. Let's
Spring and
go.
python.
Yes.
Okay, what about LI6? Ano pong classification ng LI6? Low connecting point ng large intestine meridian. Anyway, wala pa tayong low connecting. We're going to take that up maybe end of the month. Okay. Okay na yan. Memorize mo yan ang 4. Which of the following are... Okay.
Which of the following points are open needled horizontally? Stomach do 20, stomach 8, blood, what's this, sir? Bladder 2, and REN 17.
So, which are correct?
Sir, I think all of them are correct.
Wow, galing. How do you locate? Never mind. Number 4. Okay, ito importante po. Ito ha, if possible, kailangan malaman mo may arrival ng chi. This is called the dot chi sensation. Okay,
Yes, sir. Yes, Doc.
what are the signs of the arrival of chi?
If there is soreness, there's an arrival of chi, and numbness, heaviness, and distension.
Okay, so your answer is?
All of them.
Okay, letter E. Very good. Number 5, the
Yes, sir.
last
Thank
one.
you. The factors influencing the arrival of chi includes location of the points, the depth of needle insertion, needle manipulation, constitution, and sensation of the patient. I believe all of them, sir, is right. All choices are correct.
Okay, if the constitution of the patient is weak, mabilis ba mag-arrive ang chi o matagal?
No, sir. If the constitution of the patient is weak, the arrival of the chi is very slow.
Okay, very good. Galing. Thank you very much, Sir Omer.
Thank you, sir.
Congratulations,
Thank you,
you answered them all
Thank you.
correctly. Okay.
Thank you, sir.
Thank you po. Okay, punta naman tayo kay Ma'am Ami Glorioso.
Good evening, Doc.
Good
evening po.
evening. Okay. Ano po ang cause? Bakit? How many of you experienced this? Hindi na matanggal-tanggal yung ngipin. Ano kaya ang cause noon? Would you like to answer, Ma'am Ami? Can you read the question, please?
Stuck needle may be caused by, number 1 is strong spasm of the local muscle after the insertion of the needle. Number 2 is the needle with too large amplitude. Number 3 is drilling the needle in one direction only. And number 4 is poor quality of the needle.
Your answer?
My answer, Doc, is letter A.
Wow. Congratulations. Correct.
Thank you.
Okay. So, sino naka-experience nito na hindi na matanggal-tanggal? This usually happens when you do scalp acupuncture. Kaya mas maganda pag nag-i-scalp ka, you use the EA, electrical acupuncture. No? Okay. So, electroacupuncture pala. Okay? So, try to remember that. It has nothing to do with the quality of the needle. Pwedeng nagkaroon ng strong spasm. Ma'am Ami, hanggang number 10 po kayo, ha? Number 7, bent needle.
Bent needle may result from unskilled manipulations or too forceful manipulation. Number 2 is the needle striking the hard tissue. Number 3 is a sudden change of the patient's posture. And number 4 is treating the needle with too large amplitude.
So
The
your
answer,
answer,
Doc, is all of the above. All of, yeah. Letter, letter E.
letter E.
Letter A.
Ano ba? E or A?
A, Doc. Sorry.
Okay. Anong ginagawa pag nag-twirl ka? Anong nangyayari pag nag-twirl ka ng needle with too large amplitude? Sobrang twirl mo. Stock needle, di ba? Ang bent needle, okay, 1, 2, and 3. Okay. Let's
Okay.
proceed to number 8, Ma'am Ami.
The indications of the needle is or are: number 1 is high fever. Number 2 is loss of consciousness. Number 3 is sore throat. And number 4 is local congestion or swelling. The answer is letter E.
Okay. Yeah. Correct. Doon natin ginagamit sa mga Jing Luo.
Yes.
Okay. Very good. Jing Luo, Ying Spring. Number 9. What are the functions of the three-edged needle?
The functions of the three-edged needle are: number 1 is to promote the smooth flow of qi and blood in channels. Number 2 is to dispel the blood stasis. Number 3 is to eliminate the heat. And number 4 is to reinforce the deficiency.
So what's your answer?
My answer is letter A.
So why is number 4 wrong?
Wrong because kulang po. May kakulangan po. Reinforce of deficiency.
Kailan mo ba ginagamit ang three-edged needle? Kung may excess or may deficiency?
Excess.
Kailan po ginagamit ang?
Kasi binibleed mo eh. Pag may
excess.
Pag may deficiency.
Excess.
Ito nga, hindi nila.
Kaya ka nagbe-bleed.
Yeah, okay. Baka lalo maging deficient, no? Pag inano.
Sa high blood, like for example, sa high blood.
Yes. Number 10, correct. Number 10, Ma'am Ami. Last question for you.
The cupping method has functions of: number 1 is warming. Number 2 is promoting the free flow of qi and blood. Number 3 is dispelling cold and dark. Number 4 is diminishing swelling and pain.
So what's your answer?
Letter E.
All of the above?
All of the above.
Okay. The answer is all, letter E. Congratulations, Ma'am Ami. Tinago mo isa mong sagot. Okay, thank you po. Ang gagaling nyo, grabe, very inspiring. Now, nakita ko yung mukha ni Dr. Sam, mukhang busy-busy. As a clinic.
Yes, Doc.
Do you still have the energy?
I still have, Doc.
Okay, from 11 to 15, can you take care of it, Dr. Sam?
Sure. Let me try.
Let's try number 11. Please read.
Okay. Okay, which of the following needling techniques belongs to the reinforcement method? The answer is lifting the needle gently and slowly. Second is rotating the needle gently and slowly with small amplitude. And then I think it's all of the above, Doc.
Okay. Withdrawing it rapidly. So do you, meron pala. You press the hole to close it, no?
Yes.
Very good. So, are you doing this in the clinic, Dr. Sam?
Yes, Doc, I'm doing that one.
Okay. So the keyword here is slowly and gently, small amplitude, close the hole. Thank you. Congratulations. The answer is correct. Letter E. Number 12. Number 12, the function of moxibustion.
Okay, the function of moxibustions are to warm the channels and expel cold, and to induce the smooth flow of qi and blood, and then also to strengthen the young from collapse. So mayroon kasing warming effect ang moxibustion.
Okay.
So, and also to prevent diseases and maintain health.
Wow, ready.
Lahat po yan. The answer is all of the above. E.
Okay. It's so obvious that they're doing moxibustion. Okay.
Yes.
Very easy. Number 13, Dr. Sam.
Okay, moxibustion with ginger can be used to treat weakness of the stomach and spleen and yang deficiency. So I don't think that we can use this for invasion of heat and yin deficiency.
Okay. So any comments here? Ang galing. Okay. Wow. So far, ang gagaling nyo lahat. Okay, number 14.
Okay, let's try. An appropriate posture is selected for a patient according to the location of the points utilized. And hold on, which one? And the duration of the needles are retained for a treatment. So ito po yung posisyon ng pasyente kung paano mo ba siya i-acue, paupuin mo ba, pahigain, pain. So the manipulation utilized for acupuncture and moxibustion treatment. So makaka-apekto po yun. And then the position best able to painting, bent, needle, stop needle. The answer is all of the above though.
Okay.
It's letter E.
What causes fainting sa mga nininido? Anong position sila dapat?
Dapat dok nakaupo. Kasi kung yung fainting kasi katulad ng magkakaroon ng sa experience lang yung bloodletting.
Nakatayo.
Nakatayo. Nag-faint talaga sila dok. May malaki pong possibility.
At saka like pag walang kain ng more than 4 hours.
Yan yung nga pala.
You have to make sure may laman is 2 hours prior. 1 to 2 hours. Okay, maraming salamat. Kasi may nangyaring ganyan sa isang medical mission. Nagpanic, hindi ko sabihin mga walang tulog, nagising ng maaga, then nakaupo lang. Kaya there are so many things that you have to consider. It's not only the like if possible, meron kayong recliner, no? Kasi dapat rest. Especially kung napakapayat ng pasyente. Maraming salamat. And number 5, Dr. Sam. 15 pala. 15, sorry.
Which of the following points are commonly used for moxibustion with salt? Yung I think it's Ren 8.
Okay. Okay. Maraming salamat. Congratulations, as usual, perfect. Thank you, Dr. Sam.
Thank you, Doc.
Okay. Gagaling nyo lahat. Wow. Sino pa ba hindi tinatawag? Okay. Ma'am Lane Arandia. Ma'am Lane, are you there?
Yes po, Doc.
Okay. Are you ready? 16 to 20. Malapit na tayo matapos.
The functions of moxibustion on ginger includes number 1, clearing pathogenic heat, 2, dispersing cold, 3, detoxification, and number 4, warming the middle jaw. My answer is warming the middle jaw.
So your answer is letter D?
Yes, Doc.
Anong effect ng moxibustion sa cold? Take note, ginger has a warming effect. Hindi mo ba siya i-consider pag disperse ng cold?
Pwede, yes po, Doc. Dispersing cold and warming the middle jaw para po mainitan po yung load po ng katawan.
So bakit hindi natin pwedeng gamitin to clear pathogenic heat? Mainit na, di ba?
Yes po, mainit na po siya.
Detoxification. So do you do that for detoxification? Mainit na
Yes
dati,
po.
madaming toxin. You don't do that. So the correct answer, what's your answer po?
warming the middle jaw po, tsaka yung dispersing.
Okay, 2 and 4. So the answer is letter C. Did everybody, any comment from others? Okay, number 17. Ito, alam mo na to. Okay.
The channels distributing to the back of the body include number 3, the do channel.
Wala tayong option na 3 lang.
Teka po.
Ganito ha. Actually, maganda yung Morse type kasi you get to guess kung ano talaga yung like A, B, and C. 1, 2, and 3 is A.
Letter A is no. Letter B, 1 and 3.
Okay. Ilang points meron ang kidney channel? Did you read? Did you watch the video?
Kidney channel.
What's the last point of the kidney channel?
Kidney 27.
Okay. What about bladder channel?
Bladder channel, bladder 67.
Okay. Next, number 18. Medial aspect naman of the leg. Naku, napaka-importante po nito. Medial, no? Please read the question, ma'am.
The channels passing through the medial aspect of the legs include number 1, the liver channel, number 2, the spleen channel, the 3, the kidney channel, and the gallbladder channel.
So
My
all.
answer, Doc, letter A.
Okay. So ang gallbladder channel, saan po siya aspect?
Lateral.
Lateral aspect. Okay. Okay. Number 19, ma'am.
The channels linked with the throat include wait lang po. Letter number 4, Doc, the stomach channel.
Only the stomach channel? Diba, una-una mo na isipin si lung, diba? Throat yan eh. May kinalaman sa throat. Diba? So hindi mo pwedeng tanggalin si lung. Yeah. Okay. Liver. What about the liver? Di ba na-stress ka na dati, ma'am?
Yes.
Ano
Yes,
napansin mo
yes,
sa
Doc.
throat mo? Like masyado kang may liver chi stagnation. Ano napansin mo sa throat mo? Parang merong kang bukol, parang merong hindi na tatawag na plum pit throat, plum seed, no? Yun. Okay. Kidney channel, malapit na po sa throat yan. Actually, papunta siya. Okay. So, the correct answer is?
1 and 3. Letter A, Doc.
So, only 1, 2, and 3? Who would like to disagree?
I do disagree, doctor. I prefer E. All of them are linked to the throat.
Okay. Including the stomach channel. Okay. So, i-review nyo yung yung 20 minutes. Did you all watch it? How many watched the video on the channel pathways? Namnamin nyo ulit. You have to listen to every word there. Okay? Yan. Okay.
Yes, doctor.
Number 20. Asan na si ma'am? Nawala.
The channels distributing to the cheek include 1, the stomach channel, the small intestine channel, and number 3, large intestine channel.
Okay. What's your answer?
Letter A, Doc.
So 1, 2, and 3. Very good. Congratulations, Madam. Okay, how many times did you watch the channel pathways? Do you already have
One.
your email? Ma'am Ami. Ay, Ma'am Lane. Sorry. Napanood niyo na yung video?
Ano lang po, Dok, hindi tuloy-tuloy may mga na umpisahan tapos hindi ko natatapos.
Hindi na naman. Okay, panoorin nyo 5 beses. Kung po pwede 10, no?
Okay po.
You try to memorize. And that's
Okay po,
very,
Doc.
very important. And this can help you with point combinations. Maraming salamat po, Ma'am Lane.
Okay po, Dok.
Okay, let's go now to, meron pa akong hindi natawagan. Ba't lang nawala? Oh, Sir Michael. Sir Michael?
Hello po, Doc.
Yes,
Quick
so
talk.
21 to 25. Please give your answers. Basahin niyo po yung 21.
Okay, number 21. The channels linked with the eye system include the heart channel and the liver channel, which is letter C.
Okay, very good. Kaya yung mga may sakit sa puso o may diabetes,
Yes.
okay, yung mga may hypertension, nakikita, di ba, yung likod ng mata natin, yung fundus. We look at the optic disc, we look at if there is a presence of papilledema, yung mga hemorrhages. Okay, nakakita na ba kayo ng ng likod ng mata using the funduscope, no? Anyway, whatever. But the heart channel and liver channel, it affects the eyes system. Okay, so your answer is?
Letter C po.
2 and 4. Heart, liver.
Number 2 and 4, yes. And the liver and the heart.
Okay. Number 22.
Number 22 is beside the kidney and bladder. The kidney channel is linked with letter C again, the heart and the spleen.
Okay, what does
So we connect the kidney and the
bladder?
kidney channel. Yes, the kidney channel is the number 2 and the number 4. Yeah, connected. Yeah.
Anong kinalaman ni spleen kay kidney?
Kidney. Asa po yung transform to ng
Anong
ng blood
kailangan ni spleen for it to perform its TNT, transformative and transporting function? What does it, need the kidney for?
Nutrient. Nutritive.
Kidney yang. Okay?
Kidney yang. Sorry po.
Okay, 23.
The 23, the channels distributing the chest and abdomen include kidney, stomach. The stomach, not the spleen. The stomach and the liver. Letter C po. Channels distributing the chest, abdomen, stomach, and yes, confirmed. Number 2 and 4, which is not letter C.
Where is the spleen channel? Where does the spleen channel end? Ilang points ba mayroon ng spleen?
This point. Yan. This point. Ano na po?
Nasaan ba ang spleen channel nag-end? Anyone?
21, Doc.
Okay.
Sorry po. This one.
Okay. So, kasama si spleen.
Apo.
About the kidney channel. Diba dumadaan siya, nadidistribute sa... Ilang points ang kidney channel?
27, Doc.
Okay. Ano yung front mo point ng kidney channel? Front mo. Ibig sabihin, pag in-attack, let's say meron kang kidney stone, sumakit, this is a very effective point. So you usually use the front move if there are acute conditions. So ang tanong ko, what is the front move point or the alarm point of the kidney channel?
D1?
No. Gallbladder 25, GB 25. So kahit hindi siya sa channel niya, pero pag if you have kidney issues, sumakit yung flank mo, no, you try to needle that area, GB 25, gallbladder 25. Ang tanong, nasaan ang gallbladder 25? Okay. Nasaan ang front mo ng stomach channel?
Parang
Ano?
lateral.
Diyan mo. Pag pinrest yung point na to, this can confirm na may problema ka talaga sa stomach.
Okay.
What part of the REN channel? Common yan.
Okay. Take note. Gallbladder 25. Yeah.
Anong gallbladder? Stomach channel. Front view of the stomach channel. Saan? Front mo of the stomach channel?
View.
Ren point. Stomach channel. Nasaan? Okay, ano ba ibig sabihin noon? Like, okay, may suspicion ka na may problema ang stomach channel. Ano yung gagamitin mo na, ano yung ipapalpate mo na point to confirm your diagnosis? Let's ask Ma'am Teresita. Do you want to help? Gusto ko ngayon pa lang alam na natin yan. Kasi pag andun na tayo sa actual, nakakalimutan pa rin. Okay, kidney channel. Ano ang front view point ng kidney channel? Gallbladder 25. What about the stomach channel? Nasa REN meridian.
REN 12.
TV
REN 12. So
REN
what
12.
is my next question? Front move of the spleen.
Front
Liver
muna,
13.
spleen ay liver 13.
Liver 13.
Wow, very good. Ang liver channel, nasaan yung front move point niya?
Liver channel.
Liver 14.
14. Oh, liver 14.
Memorize nyo na yan, ha? Again, kidney channel, GB.
GB 25.
Stomach channel.
REN 12.
Okay, so you palpate that area. You use the probe. Nakita mo, humilap ang tiyan. Merong GERD, no? If you, to confirm your diagnosis, you have to palpate kung masakit. Spleen channel, liver
13.
Okay. Where is liver 13? Okay, di bali na.
Sa gilid.
Okay, ganyan ang mga tagal lang mag-aaral. So we need to be very familiar. In fact, the front move can actually help you diagnose what is the acute condition. Ngayon, pag chronic naman, yung back shoe. I would like you to also memorize the outer back shoe. Outer back shoe is more on the psychological aspect, no? For example, bladder 13 is the back shoe point of the lung. Okay, so ang bladder 42, you just have to add 29. Don't ask me why. So, yung malapit na sa middle border talaga ng that's for grief, no? Kaya palpate nyo yon. Wag lang yung back shoe. And you will end up with a very happy patient. Okay? Yon.
Okay, Doc, thank you for the info.
Okay. Yeah, I'm very excited to share them with you. So we just wanted you to know that we're very serious with the training. So there's no turning back. You can only expect quality trainings from us, especially Module 1. No? So, konting effort lang po. Gusto ko kasi, and do you find this Saturday thing very worth your time?
Yes.
Yes
Yeah.
po, Doc.
Yes,
Sige,
Doc.
konting tiyaga lang. Meron pa tayong 5 Sabado for Module 1. Actually, marami pa. Okay, number 24. Ito, yung mga sumasakit ang Sir Michael, please continue. What's your answer here? Can you read the question, please?
Number 24, the channel links with it into, kasama ko dito.
Sige, go.
Kasama ko dito. The stomach and the large intestine.
Okay. Asan dyan yung upper teeth? Saan yung lower teeth?
Lower teeth. Yeah.
Sige, assignment.
Assignment.
No? Kasi 'di ba, yung iba masakit lang yung taas. So, you have to know what channel is connected there. Is it the stomach channel or the large intestine? So, I hope you all remember this. So, read. Don't worry, when we go to the clinics, the needling, diretso yan. Okay, last one for Sir Michael.
The liver channel pass through the genitalial, the lower abdomen, the costal and hypochondrial region, the posterior aspect, malleosus.
What's your answer?
Hindi naman pwedeng C. All of the above po. Letter, no po.
Your time.
Okay.
Letter A.
Yes.
1, 2, 3. Yeah. 1, 2, 3 po. Letter A, the external fascia, the lower abdomen.
Pag nangangati yung yung private part mo, what channel are you going to investigate? Kamot ka ng kamot. Yan na, di ba?
Liver.
Liver. Okay. So maraming salamat, Sir Michael. Your answer is letter A.
Letter A po.
Very good. Thank you po. Now, sino pa bang hindi? Okay. Ang gagaling nyo. So we're now down to the last 6 questions. So lahat na ba nakaparticipate? I'm sure Dr. Ryan is busy. Would you like to... Okay, let's go back to... Okay, balik tayo sa kay Ma'am Angel. Ma'am Angel, let's pakibasa po yung 26.
Number 26 po. Beside the liver, the channel is linked with 1, the gallbladder, 2, the lung, 3, the stomach, 4, the heart. Ang answer po is letter A po, all of the above po. Ay, hindi. 1, 2, 3 lang po pala. A.
This is about the channel, mga linkages nila. Okay, ano bang relationship po ng liver sa gallbladder?
Si liver po yung nag-extract po ng bile. Ine-store po ni gallbladder.
Okay. Interior-exterior relationship. Okay. Anong kinalaman ni lungs pag may problema ka sa liver? Let's say meron kang cirrhosis. Nakita nyo ba yung mga skin? Di ba lung is skin, no? Ano usually napapansin nyo?
Parang may rashes for dry skin.
Okay, very good. What about the stomach? Let's say kung galit ka, anong nangyayari sa stomach mo? Para ka bang nasusuka? Para ka bang...
Yes po. Para pong may hit po sa tiyan.
Okay,
Kasi
nakaka-relate ka
nag-deliver
ba?
fire. So, yung stomach po, nagkakaroon ng fire din po.
Naranasan mo na ba yan, Ma'am Angel?
Yes po, parang masakit po yung, sumasakitin po yung tiyan, nag-acid reflux, parang ganun po.
Okay. So, ibig sabihin, aayusin mo, hindi lang yung stomach, kailangan liver.
Yes po.
Diba? Okay, very good. Tuloy-tuloy na natin. Tapusin na natin. What's your answer for number 27? Ito napaka-importante po yung mga gustong tumalino, hindi magkaroon ng Alzheimer's, the channels entering the brain.
Number 27 po, the channels entering the brain include the do channel, the liver channel, the bladder channel, and the gallbladder channel po. All of the above po.
Okay. Very good. Kasi pag andyan si liver, andyan din si gallbladder, di ba? Oh, si do, pati si bladder channel, ano yan, lahat papunta sa brain. Okay, number 28. Kaya tignan nyo balik po tayo dito. I think the reason why a lot of people nagkakaroon ng dementia or Alzheimer's, no? Because not too many of them know how to manage their stress. Napapaano tayo sa stress. So, don't be stressed by stress. Nagets nyo? Di ba yung bladder channel nasa likod? So, yung pa nating may mga issues sa likod, may mga hugot na yan, mga chronic issues. Kailangan nawala yan. No? Gallbladder, yes. Gallbladder, try to needle gallbladder 21. You'll end up with a patient who's very, very happy. Okay? So, yon. Number 28. Malapit na tayo matapos. Ma'am Angel.
Number 28 po, the channels distributing to the ear includes number 1, hand xiaoyang, number 2, hand tying, and number 3, foot tayang.
Okay, ano pong channel itong si Han Xiaoyang?
Stomach channel.
No. Xiaoyang.
Pericardium po.
Oh no, sorry.
Lesser Yang. Anong pericardium? Yin ng pericardium.
Triple burn or triple energize.
Okay.
Han Xiaoyang.
Burner. What about Han Taiyang?
Small intestine.
Okay, small intestine. Tapos sino pa to? Isa, foot Taiyang.
Bladder channel.
Foot Taiyang. Sino si foot Taiyang?
Urinary bladder.
Okay, very good. Yan. What about si foot Yang Ming?
Stomach.
Okay. So yon na. Alam nyo na. Ano ibig sabihin ng Xiaoyang? Yan yung memorize na memorize.
Lesser yang.
Very good. What about Taiyang?
Greater yang.
Yang Ming.
Yang Ming is right yang.
Ang galing, grabe. Nakakapagtapos. Parang ready na magpaano. Wow. Okay, number 29. Angel.
Number 29 po, Doc, is the channels distributing to the lips include the large intestine channel, the liver channel, the stomach channel, and the REN channel po. All of the above po.
Okay. Congratulations. All. Number 13. Lapit na talaga tayo matapos. Channels distributing to the forehead. Kaya kung may mga ano ka sa forehead. Number 1 dyan yung ano.
Liver.
What's your answer, Ma'am?
Yung number 30 po, ang answer po is letter A, yung the stomach channel po, the liver channel, and the bladder channel po.
Okay, what about the large intestine? Umaabot ba sa forehead?
Ilong lang.
Hindi po.
Lang. So
Hanggang ilong.
Hand to nose.
Ilong lang.
And the last one, I hope you had fun. Okay.
Yes, we have.
Of course.
Number 31.
Number 31, the channels entering the lung includes the heart channel and the kidney channel po. Letter B po.
Okay. So, ibig sabihin, memorize nyo talaga yung ano. So, thank you very much for joining. Any questions? Were we able to tackle everything? I understand medyo busy po kayo, super busy. So, you might not have the time to really read all of them. I don't expect you to read all of them. Pero, na-receive nyo na ba yung mga videos nyo?
Yes,
Yes
Doc.
po.
Thank you po.
Yes,
So,
Doc.
I
Thank
hope
you.
you treasure them because you cannot find those anywhere. So,
Tama.
I'm so excited.
Agree.
Thank you po.
So next
Tama.
week, would you be
Salamat po.
ready for anatomy? And we will start with Chi cleft point, Yuan source point, and 5 shoe points. So ready na lahat. So, and also we'll talk about a little about anatomy. So we'll just give you the ano siguro, the PowerPoint. I think you're all good. Importante po kasi basic anatomy lang talaga para you would know where the scapula is, where saan yung lumbar mo, yung sacrum, whatever. Okay? So maraming salamat po sa lahat. Any questions before we go? Can we hear your comments? Do you feel you're halfway of ano already? We're halfway na, ha? Halfway na tayo sa module 1. We have like 5 more weeks. Are you all excited for module 2?
Yes, Doc.
Yes, Doc.
Yes, Doc.
Dito nagtusok na.
Marami.
Kami, Doctor.
Unti-unti
We're
daw.
going to schedule your kasi we owe you a training for practicum. Siguro naman medyo ang dami nyo nang natutunan, no? So I think may idea na kayo what will come out, like what will be asked in your practicum and in your revalida, no? So I hope you can all study all the assessments, you keep all of them. That's why we give you copies of your, like, I think Sir Albert gave you like weeks 1 and 2, weeks 3 and 4, and then now we're going to have weeks 5 and 6. Okay. So far, well, what would you suggest to help? Are you happy with the way things are turning out? Like, are you happy with your pacing?
Yes.
Yes, Doc.
Yes, Doc.
What suggestions can you give to help motivate our brains? Actually, ang galing nyo, ha? Sa totoo lang. In fact, we have a lot of followers already. And I noticed mabilis dumami yung views ng yung assessment. We call it LAMP TCM Foundations Review. And I think many are joining us because of the knowledge, because I think the questions that we ask are very, very clinical. Do you agree?
Yes, Doc.
Yes, Doc.
Yes po.
Doc,
Yes,
mayroong magandang, we have one good comment coming from Dr. Ian Cabalsa, a friend of mine. Isa po siyang surgeon. Naka-attend siya one time sa ating webinar. At nanahiya po siyang sumali ulit kasi ang gagaling daw natin.
naman. Alam nyo, parang pakita naman natin, ang gagaling nyo talaga as in. Yung iba lang, do not be disappointed kung medyo mali yung answer nyo. Hindi naman tayo perfect. I don't expect you to get a perfect score. Sa totoo lang, I have very high regard for this watch. Parang I think you had all the time, and siguro because you watch our videos, and I'm very happy because of your support for the channel. I won't mention the name of the channel. I was so like, ang dami na palang nag-subscribe. So I just need ang napansin ko lang, hindi nyo tinatapos yung video. So I need the hours for, alam nyo na, para naman ma-motivate tayo, no? Anyway, we're doing that for you, and we hope to be able to Alam ko yung when it comes to technical, wala po tayo doon. But I think the reason why people watch the videos on the twist and calas is because of the knowledge. It's although very simple siya, but ako kasi ay naniniwala ako na you will not only watch it once, but especially when we go to the clinics, yung mga cases, you will get to watch them. So I hope marami pa tayong taon na magsasama-sama, and when you graduate, hopefully it will not be the last because you have to continue to learn. And I think we're getting the all because napakagaling niyo daw talaga. As in, almost perfect yung ano niyo. Isa lang, dalawa, no? Pero binago din yung answer. So I hope you are very happy with the way things are turning out. And I'm very happy we have Dr. Sam, who is so pagod na pagod. He looks so pagod. Ang dami niya yatang pasyente Sabado ngayon. Pero he still found time. Don't worry, Doc. This will all pay off. And thank you din kay Sir Leo na nagulat ako. Ang dami palang alam. Wow. Memorize yung mga tune measurements. To be honest, hindi ko talaga alam yung iba. No? Siguro kalahati lang doon. Kaya I really enjoy these sessions with you. And thank you, Sir AK. And we hope you can come up with a Facebook page that is very, very information packed para marami tayong mga followers. Alam ko, you can do it your own way. Siguro, I would like to say na this batch is really very strong kasi alam ko nagsisipag kayo, no? Hirap kaya aralin na. I hope you do not feel overwhelmed with the number of videos or PowerPoints. I doubt if you get the time to see the e-books that we give you. So
Honestly, times.
Okay. No, I don't expect you to read them, but keep them as a references and expect more. Thank you din kay Ma'am Ami, who is alam ko busy po kayo. Sabi nga niya, yung kanginang channel pathway, mukhang hindi niya natatapos. Ulit-ulitin niyo po yun. Especially yung mga organs na tinatraverse niya, no? Thank you kay Ma'am Darlene Federico. Kumusta po yung
Thank you po, Doc.
Opo.
Busy, Doc, pero I always find time kahit na konting-konti lang. Pag mag-break ako, insert ko, I give extra effort and yun po.
Yeah, I hope you can also educate your colleagues. Kasi alam ko yung mga clients from Okada are expecting the best from you, no?
Yes po, Doc.
So, salamat po. Alam ko busy din kayo.
Thank you po.
Pero kahit puyat siguro, andyan din kayo. And thank you kay, of course, Ma'am Angel, who is always the first, no, who comes. Grabe, parang very serious. And I hope naka-move on na sa kanyang mga frustrations before. Alam ko medyo, ewan ko lang, I hope you're very happy with our training now. We're not saying we're the best, but we're definitely not not mediocre, no? So sana magtulungan tayo. Sino pa ba? Baka magtampo yung iba. Oh, Sir Omer. Si Sir Omer, although ngayon ko lang narinig, pero alam ko marami na rin siyang alam. Mukhang seryoso lang talaga yung mukha, pero I hope hindi kayo magsasawa, no? Thank you po, Sir Omer, and congratulations for giving all the correct answers. And also sa ating enthusiastic na birthday celebrator, si Ma'am SP. Oo, Ma'am SP, kumusta ba? Asan na yung mga kasama niyo? Mukhang na-busy yata.
Busy po, Doc. Lalo na sila Criselda.
Sige, share lang kayo ha. Panoorin nyo sa YouTube, no?
Yes, Doc.
Thank you po. Marami pa kayo natutunan, Ma'am SP?
Yes, Doc.
Ano ba? Milya na ba yung agwat? Like, was there a big leap?
Yes, Doc.
Kunti-kunti na bang lumiwanag o am I just putting words into your mouth?
Bigla po lumiwanag, Doc.
Okay. Kala ko anong lumiwanag. Okay, thank you po. And
Thank you.
also kay Ma'am Teresita Sumile na medyo talagang nag-move na sa Rizal, no? Happy po kayo Ma'am Teresita?
Yes po, Doc. Thank you din po, Doc.
Yeah, excited ba kayong pumunta sa lab, no? Sana po maging alam ko magaling kayo sa theory, but I want you to apply this sa practicum talaga. Maraming salamat po. And
Salamat din po,
also
Doc.
kay Ma'am Lane Arandia.
Hello po, Doc.
Oo, kumusta po? Do you have any comments? Like, are you enjoying this so far?
Yes po, Doc. Medyo nakakawindang lang yung mga videos, yung mga PDF file na dapat basahin. Pero kaya tiyaga lang po, Doc, yung sinasabi nyo na
Ulit-ulitin nyo lang yun, babalik-balikan nyo yun eh. Kaya I hope you treasure them because you just can't find them anywhere, no? Especially yung mga location po. Hindi nyo naman matatandaan lahat yun eh. But I'd like you to go back from time to time. And
yes
of
po,
course,
babasa-basa lang po kapag may time po.
yeah. Si Ma'am Ami Glorioso, maraming salamat po.
Thank you, Doc. Thank you very much po.
Oo, may mga comments po ba kayo? Hindi ba kayo na-overwhelmed? Hindi ba kayo na-windang?
Doc, sobrang nakaka-proud po kasi ang galing-galing naman po talaga yung marami kami natututunan sa inyo.
Sana tuloy-tuloy, no? And then...
Yes, Doc. Walang sukuan, Doc.
Oo naman. Wala namang problema yon.
Yes, Doc.
Tampo-tampo lang yun minsan, di ba?
Thank you very much talaga, Doc.
Thank you po. Sino pa bang na-miss ko? Ay, si Dr. Ryan. Dr. Ryan is a PhD in nursing practice. Pag nagkaroon po kayo ng pasyenteng gano'n, you have to start really studying. In fact, it was because of Dr. Ryan that made us come up with very informative 8 to 9 p.m. sessions. Kaya kahit hindi po si Dr. Webb ang lecturer, I hope you could find time to attend. Although we don't require you because we're trying our best to make it worth your time, no? So, Dr. Ryan, do you have any comments?
Actually, wala po, Doc Heck. Yung lang, keep doing what you're doing because it's always in the step to the right direction. You make things simple, and then it's reinforceable by. It's also something you could always look back kasi may recording. And I always believe in repetition kasi repetition naman is reinforcing things na kailangan mo malaman. I mean, it may look basic to others or advanced to others, but when you keep repeating it, mag-mastery na yung level. So keep doing what you're doing. You're doing a very great job.
Well, thank you. We're really good friends. Yeah, in fact, nakakataba ng inyong mga comments, and in fact, they really inspire me to work harder. And sana po dumami yung ating tribo, yung ating group, no? And I hope tanggalin natin yung selfishness sa ating puso. Because I believe that if you are selfless, you do this because you want to help others, the blessings will come. No? Maraming salamat, Dr. Ryan. I think I forgot one more. Oh, si Sir Michael na medyo... Okay.
Medyo busy lang talaga, Doc.
Alam ko, busy, but you have a very nice new look. So, di ka ba na-overwhelmed, Sir Michael? Is it something that is intimidating?
Yeah, it's already, I could say, it's part of our journey, especially when we entering a new venture. Of course, there's a lot of opportunity out there. Of course, it's the same thing. Marami rin siyang gagawin. So, given na po talaga yung overwhelming. And may mga bagay-bagay din na darating sa buhay natin. Ako, yung marami sa office ko po, 4 po yung nag-resign. So, malaki po yung load na handle ko. So, at the same time, hindi ko pwedeng gawing excuse yun. Kasi gusto ko yung ginagawa ko as acupuncture. So, for me, nagpapasalamat po ako sa inyo, Doc. Pagkitiwala sa amin na paggabay sa amin sa adhikain namin gawin namin sa aming buhay. So, thank you for that. Dr. Hector.
Yeah, thank you. Thank you so much for the comment. Gusto nyo ba na tuloy-tuloy na natin to? Anyway, I think maganda yung may alam na rin kayo sa diagnostics. What do you think? And hopefully when we see each other for the practicum, kasi I always believe in repetition eh. And
Yeah, yes.
And branching out, like going beyond. Pero mas gusto ko kasi yung clinical talaga. And I tell you, you get the respect that you deserve. If you work hard, no? And always keep your feet on the ground, because mas maganda like we continue to work hard, because we can enrich ourselves with knowledge, and it really shows. And I noticed that not too many people are very good at diagnostics, and this is one quality that we would like every lump student to possess, because this will set you apart from the others. Ako kasi, I do not have high respect for people who do not know how to diagnose. It's just like going to a doctor, walang ginawang test, hindi mo tiningnan hindi ka naman inauscultate, no? Diba? Like, it's not like that eh. You have to customize your treatment, your protocol, and what is important is your relationship with the patient, because that can translate to more referrals. And our dream in the future is to align ourselves with the medical community, para medyo maganda na rin yung tingin nila sa atin, na hindi tayo parang mga voodoo or quackery or something like that. And how I wish that this has also been the wish of Dr. Palanca, the late Dr. Palanca, who is working hard for the term medical acupuncture. That means you are on equal footing with the MDs, with the nurses in the hospital. And that can only happen if you finish the first 2 modules, because what I'm planning to do for the 3rd module is to integrate your health, yung basic health training nyo. Kaya it's something which is really a challenge, but I love challenges kasi hindi lang ako nag-iisa dito. And let's continue to spread the word, the gospel of acupuncture. Now, it's not simply needling, it's also about diagnosing. And that when the time comes, hindi na tayo magkakasakit masyado, although hindi na tayo mahihirapan. So let's try to show the world that we know what we're doing, and we're doing this for the future of humanity. O, diba? Haba-haba na noon. Anyway, maraming salamat po. Thank you. Did I miss out anyone? Baka magtampo. My God, baka mag-walk out na naman. Ay, si Ma'am Teresita. Okay, Ma'am Teresita, o finale. Kumusta po, Ma'am Teresita? Sabi ko
Okay lang
naman,
po, Doc. Maraming salamat po sa tulong mo, Doc.
ay wow, bakit parang sickly kayo, Madam?
Yes po, may ubo at sipon po ako, Doc.
Dahil sa ulan.
Feeling lang talaga.
Oo, kaya pala. O, sige, I won't force you na to say anything. Maraming salamat po sa lahat. And
Thank you din po, Doc.
yeah, have a great weekend, everyone. Kahit anong mangyari, tuloy-tuloy po tayo. See you next Saturday for week 6. Good night, everyone.
Thank you po.
Good night, Doc.
Night, Doctor.
Bye-bye po.
Good night, Doc. Good night, everyone.
Lahat.